groundbreaking move that could save countless lives in the Nelson Mandela University's Department of Human Movement Sciences is leading the charge in the Eastern Cape for a national study aimed at tackling child hypertension, Iman.
This is a silent condition, Arbile. It doesn't show any symptoms, but it can lead to heart, kidney and vascular damage later in life. And this national research is spearheaded by Dr. Aayesha Kholvadia and her team, and she joins us now to discuss. Aayesha, good morning to you and thanks for your time. Let's just start with childhood hypertension itself and understanding what that is. You know, there's a lot of there are a lot of warnings, there's a lot of research about why adults should go and get themselves tested for hypertension so that they can avert things like stroke and so on. We don't talk about it as much with children. So just share with us what the picture of South Africa looks like when it comes to childhood hypertension.
Sure. Good morning, Iman and Arabile. It's really nice to be here with you today. So we at Nelson Mandela University, we're running a national hypertension study to establish the first ever South African blood pressure norms for children in South Africa and the larger Africa between the ages of 8 and 18 years old. Currently, we rely mostly on overseas data for this blood pressure norms that we're using to diagnose our children with blood pressure, which doesn't reflect our children's unique realities. So high blood pressure in children, as we know, is a very silent risk factor, and we often pick it up when it's too late, once there's already heart disease and stroke. And it's also a key indicator for stroke and heart disease later in life. So we're heading and working with a combination of teams all across the country to be able to identify and create African and South African blood pressure normative data for diagnosing our children with hypertension or blood pressure.
It's really important because you are creating something new, ostensibly, these new blood pressure norms and standards. The understanding then would be that it's different to the norms and standards for adults. What is that difference, Aayesha? And I think for parents watching is, you know, how on earth do we know we should get our child tested in the first place?
Yeah, so it is different. Like, I think for adults, we're all very well aware that the top value, which is our systolic value, should be anywhere less than 120, and then the bottom value should be between 80 and 85, and that would be what is the norm that we're looking for. But for children, that would differ a lot as we look at the percentile of growth, right? So in a children population, we would look at between different ages, and it would be a percentile of that blood pressure value that would be the norm that we're looking at. So those percentiles have been worked out and documented on a very Eurocentric population and normative data value, which we have found with research over longitudinal tracking that those values do not represent what we are seeing currently in children within the continent of Africa.
Dr. Kholvadia, the question could also be, I mean, and this relates then to one of the grade 6 learners that you've identified then as the Nelson Mandela University. Dangerously high blood pressure leading to a kidney diagnosis there. How often do those life-saving interventions need to occur, and then the follow-up that would be needed for situations like that? I don't know if you're able to share more with regards to that situation.
Yeah, so we've also been busy with this study for the last 2 years, where we've been visiting schools within the different districts, both in the Eastern Cape as well as other provinces in South Africa, and we've been testing blood pressure for these children. And almost regularly, I would say, with every single testing cohort, we tend to pick up children, 1 or 2 children at least, who have abnormal blood pressure. So they would be screened over the week And then once they are detected as being hypertensive or abnormal blood pressure, we then look at what they collaborate with the principal as well as their parents and guardian, then take it on with the local clinic and the local healthcare provider to be able to look at what are some of the interventions that these particular children would need. So, for example, this grade six learner that we had over the week of testing that we did at this particular school, we picked up consistently high blood pressure, and the little child kept complaining of headaches and also blurry vision. Right. And so, in looking at that, we found that the family also has a familial history of hypertension. And then we were able to intervene and get the relevant care for this child who is now on medication to prevent stroke and other long-term medical complications.
It's going to then be very important to ensure that blood pressure is consistently screened or tested. Do you envision that becoming a routine part of school health programs, perhaps even nationwide? And what policy changes would be needed to make that happen?
Yes, 100%. And that is one of the things that we're looking at with this particular study is then to advise policy in terms of not just looking at, for example, BMI and growth measures, but also looking at high blood pressure and heart rate, which would be our baseline measurements for cardiorespiratory and cardiovascular diseases, which have been shown to grow or to impact further into adulthood.
So much more to be said about this as well. Dr. Aayesha Kholvadia, thank you so much for the time. Thank you for helping us understand it a lot better from the Nelson Mandela University as we speak about childhood hypertension.